My name is Arlee Wallace. I'm the African American Health Program Manager. I do want to welcome everyone and especially thank the partners of the African American Health Partnership for supporting us, which includes the African American Health Program Executive Committee, the African Advisory Group, the Caribbean Advisory Group, and the Black Ministers Conference of Montgomery County. Tonight's forum will start and be headed by our moderator, Tiffany Ward. Tiffany?
Hi all, thank you for joining us tonight. We really appreciate you coming to listen to and to participate in this important discussion on racism as a public and mental health crisis. We are going to be joined tonight by a wonderful panel. But first, I want to ask Reverend Kenneth Nelson to welcome us with an opening prayer. Reverend Nelson is from Seneca Community Baptist Church, and he is a past president of the Black Ministers Conference of Montgomery County.
On behalf of the members of Seneca Community Church, we welcome you to this event this evening. And we pray that justice runs down every river in Montgomery County, and righteousness flows to every dry patch of injustice and inequities. We pray that your soul may prosper in all things, and that in the memory of a murdered innocent man, Jesus on the cross, your soul in this corrupt society, it will be redeemed. We further pray that all of you will be blessed as peacemakers. Amen.
Amen. Thank you, Reverend Nelson. So joining us today, we have County Executive Marc Elrich. We have our District 2 Council Member, Craig Rice. We have Council Member Will Jawando, Dr. Raymond Crowel, from the Director of Montgomery County Health and Human Services, Dr. Travis Gayles, our Public Health Officer here in Montgomery County, Dr. Georges Benjamin, Executive Director of Association of Public Health Officials, and lastly, Sonia Prutt, the National Chairwoman for the National Black Police Association. I'd like to open with just a few remarks from our elected officials. Let's start with our County Executive, Marc Elrich. You're muted, Marc. You're still muted.
Okay.
There you go. There we go.
I didn't mute me. First of all, I'm not in the mountains. This is just the picture I took that I managed to make my background. I don't want anybody to think that I have escaped the heat here and I'm in some cool alpine environment. I do want to thank everybody for putting this program together. And I really do think this is important. It's probably the most important work we're going to do. And though we're mired in the middle of the coronavirus crisis, all the problems that faced us before this crisis will be staring us in the face when this is over with. And in this last killing of George Floyd, it's staring us in the face in the middle of this crisis. And I'm actually glad that people summoned the energy to focus on what is really a long-term American illness, which is racism in the midst of the corona crisis. It says a lot that people were able to drop their concerns for day-to-day life and realize that America's been in crisis for a long time. Earlier today, I was going to read something and I was going to start about how this is a difficult moment in American history. And I changed it because basically America's had a 400-year crisis with racism. It ain't in the moment. And, you know, the death of George Floyd didn't make me think anything different about what's going on here than any of the other deaths, whether it's Tamir Rice or, you know, Eric Garner or anybody else who's been murdered, or whether it's the burning of Tulsa, the bombing of Tulsa about 100 years ago. This is a continuation of America's inability and unwillingness to deal with race and to deal with people who were brought here on no account of their own and have never been allowed to fully integrate into society. So I think it's a pivotal time for the county and the state and the country. I'm old enough to remember the riots that happened in the early 60s, and then everybody passes a bunch of civil rights legislation. I'm old enough to remember the riots of '67 and the Kerner Commission that came afterwards. And I'm old enough to remember Rodney King. And at multiple times we've said we're at a pivotal moment in American history. And in multiple times we haven't pivoted. And we passed legislation, which is nice. And we extended legalistic rights, which are nice. But the economic underpinnings of racism didn't change. And so I could pass a voting rights bill, but if you still can't afford the rent, or if you're living in slums where nobody feels they have any obligation to enforce housing codes, if you face discrimination at work or you face discrimination in any part of your life, most of that stuff wasn't covered by law. And I tell people, it's one of the things that has made me more aware of, how to frame this in a way that maybe makes more sense to people is, and I told people this before, so pardon me for saying it again, but, I'm a white guy. And I got to say, never in my life did I have to think about the implications of being white. I never had to say, like if I'm in an interview, what do people think about a white guy? I never had to think when I went for a bank loan, I'm a white guy, how are they going to judge me? I never walked into a store and had people follow me and say, these white guys, you can't trust them. You got to watch them every minute. I never had to think about that. And then I look around and there are people who think about that every day. And that's my grandkids now. And they are painfully aware of this. And it's a way that I think most people haven't thought about this, but if you had to think about how people thought about you 7 days a week, 365 days a year, in everything you do, that takes a toll. And people like me have been relieved of that. We don't have to think about that. But thinking about what it would be like if I had to think about that would make my life much more difficult, because at every moment I'd be thinking, I'm not being judged on who I am, I'm being judged by what I look like. And that's an unfair burden to place on anybody. It's not reasonable to expect people to go through life with that kind of burden and come out unscathed. And we're going to have to be more serious about what we did. So I started by saying, legislation's nice. We're going to have to attack some fundamental economic underpinnings of this system. You can't have a system that takes minority communities and relies on them primarily to provide cheap labor. It's just a slightly more expensive substitute for slavery. And we have to figure out how we're going to raise wages to the point that people can actually afford to put a roof over their heads and take care of families. We have to provide educational opportunities that raise people up. I was a former school teacher. Anybody who's been involved in the school system for 20 years knows how many times we've talked about whether it was all, success for every student or whatever different name we gave to it at different points in our history. The results are pretty much the same. We do not have success for every student. And we have not done what we need to do. And part of it is in the schools thinking there's a curriculum solution for what's really an underlying social problem. If kids come to school hungry, which is something I saw as a teacher, if they're moving, if they're displaced because they can't afford to pay rent, if their parents go through marital strife because of the economic burdens that they're under, all that takes a toll on kids. And it's hard to go to school and be a student when you're in a life which is oftentimes involved in turmoil. So if we're not willing to address the fundamental economics, and if we think this is just some neat little legislation here and there, we won't change anything that really needs to be changed. And I firmly believe we need to address issues in policing. But I've said this before, if I fixed everything in policing tomorrow, it doesn't deal with inadequate housing, it doesn't deal with inadequate access to healthcare, it doesn't deal with an inadequate education, it doesn't deal with discrimination in hiring, it doesn't deal with any of the underlying problems. The police are part of it, or policing more correctly is part of it. But if you do that, it does not end the struggle that we now have to engage in. And so we're going to have to talk about more substantial things that deal with the economic life of people so we can change the quality of life of people in a meaningful way. I don't have to tell you all these statistics, but I will. We know that Black men have the lowest life expectancy and the highest death rate from specific causes compared to both men and women of other racial and ethnic groups. We know the leading cause in deaths in 2017 for Black men was heart disease, cancer, unintentional injuries, homicide, stroke, diabetes, chronic lower respiratory diseases, kidney disease, septicemia, and hypertension. For young Black men between the age of 15 and 41 and 44, the number one cause of death in 2017 was homicide. Homicide. This forum is important because on the one hand, you all know all this stuff. On the other hand, the tools we've been willing to apply to this stuff do not meet the task. And I think that's the job for America going forward, is not some nice little feel-good legislation and bold statements about, how outraged we are by these killings, but it's going to require a deeper dive into the structural nature of our economy and who wins and who loses and how people decide who wins and who loses, and then fundamentally dealing with that. I mean, I've talked from the time I was running about the need to shift our housing programs from rental to ownership, because if the number one impediment to wealth is the failure to be able to have opportunities to build wealth, and that's how the white middle class built its wealth, was largely on ownership, we've got to find a way to transition our programs from rental to ownership. And I can tell you that's going to be a struggle even with some of our nonprofits who have not been welcome to the idea of fostering ownership rather than helping people by trying to provide affordable rents. It's a noble goal. It certainly helps people limit the amount of expenditures they have, but it doesn't deal with the fundamental issue of will you be able to build wealth, or will you not be able to build wealth? Those things are critical. I'm looking forward to discussion. I'm really looking forward to moving on things that produce more action, and hopefully that the political leadership here in the state, and perhaps after November in the country, will be willing to talk about things at a really and truly fundamental level and do the work we need to do. So again, thank you all for putting this on. I look forward to the discussion.
Thank you, County Executive. Councilmember Rice.
Well, thank you very much, Ms. Ward, and I really want to thank my partners at the African American Health Program for their continued partnership over the many years that I've been a part of this council. I really want to thank you for your leadership, and again, continuing to strive for better outcomes for people of color throughout this county. It really is truly important and says something about the fact that we've been working on this for a very long time. We've acknowledged the fact of when we have lower birth outcomes with our women of color, primarily our African American women, so much so that we had to set up specialized programs to ensure and counter low birth weights and other kinds of at-risk conditions that women found themselves in. But one of the things that I wanted to highlight that picks up off of where the county executive left off is talking about the systemic racism that continues to exist. I talked about this just a couple of days ago when a good friend of mine who's a teacher at Richard Montgomery High School, creator of the Jaguar Leaders Program when he was at the middle school, the feeder middle school there, had gone to his doctor who was not his primary doctor and was treated so badly that he walked out. This is a professional young Black man who walked into a doctor's office to get a regular checkup. And because of the way he was just treated and dismissed, walked out and left that appointment. That's what's happening now. And so when we think about what it is that really stands in the way of us continuing to make sure that we have healthier outcomes, the reality is we have a lot to fix. I'm a product of the South, as many of you are. My mother from rural South Carolina, my dad from Hampton, Virginia. And so they were deeply rooted in the civil rights movement and saw segregation and saw integration But the reality is that those wounds, right? The wounds that we talk about, and I'm going to get a little doctor speak here, never truly healed. And now what we're seeing is that COVID-19 just kind of crept its way in, is now infecting that wound. The George Floyd incident is infecting that wound and creating some of those same challenges with that wound that never fully healed. And so, of course, we are going to be hurting. Of course, we are going to experience the same pain that we felt before because it never went away. It never was truly healed. We never fixed it. And since we never fixed it, we should not be surprised that the outcomes that we experience, the challenges that we see, the racism that affronts us is not something new and is no surprise to any of our people of color in our community, especially our African-American community. And so, look, as a young Black man who grew up here in Montgomery County, and it's interesting, Mark, because you talked about some of the things that truly are the things of privilege. My mother always told me, and she's sitting right over here watching this video, she always told me, Craig, you've got to be better. You've got to be better. So when it comes to dressing, you got to dress better. When it comes to talking, you got to talk better. When it comes to education, you've got to educate yourself better, because they are always going to think less of you when they look at you and they see you. And the amazing thing is that still today, that's ingrained in me. It's ingrained in me, and it's something that weighs on me every single day, where I'm always thinking about the fact and the heaviness that weighs on me. So when we talk about the stress that's associated with our Black men in our community, who always have to make sure that they're not seen as a threat, who always have to make sure that they're seen as a person that's acceptable to be in a position, to always be seen as the person who's not going to rob or kill someone, to be seen as a person who deserves to live another day. That's a hell of a lot of stress to have on someone every single day. And so, of course, we experience the outcomes we do. And let's not talk about, and I'm gonna be quick, let's not just talk about also the fact of, folks always want to say, well, if Black folks would eat better food. Well, that's rooted in history too. It's very interesting, because in history, we always got the worst parts of the animal, right? And so because we got the worst parts of the animal, I'm speaking real talk here, right? My folks from the South know exactly what I'm talking about. So you had to season it more, because the flavor of the meat wasn't the same and it didn't taste the same. And so you had to put other things in it to make sure that it tasted as good as what the white counterparts would be able to eat. That's history. That's real. Those are the things. And so that habit of that kind of seasoning, those kinds of things are ingrained in who we are and how we cook. So yes, those are the kinds of things that are there. But the reality is that doesn't make a difference if you still have to deal with the burdens, if you still have to deal with the racism, if you still have to deal with the injustices. That's just one little small part. The reality is that you still have to handle all of these other things that are in front of you. And so yes, racism is real. Racism exists here in Montgomery County. I've seen it. I've experienced it. Friends of mine experience it all the time. My daughters, for the first time, have truly experienced the level of racism that I've been warning them about for a very long time. I told them that these things existed, and they told me, Dad, things have changed. It's not the same as when you were growing up. But it's interesting is that they have their conversations on social media, talking about the George Floyd case and what's going to happen. It's very interesting to hear that they now say, oh my God, I can't believe that kid I knew was so racist. What does that mean? Well, that means that now my daughters are going to encounter the same level of stress that I was. Black man, Black woman, doesn't matter. We're all experiencing it. We all experience the challenges of trying to make sure that folks see us as equals. That's a heavy burden. And so for us, we're going to try and make that easier of a burden by doing some of the things that you'll see the council initiatives, working with our county executive, working with our Department of Health and Human Services, working with our public health officer, Dr. Travis Gayles, working with the community, working with the African American Health Program. We can do this, but it requires all of us to say, enough is enough. We've got to start making some serious changes. So thank you.
Thank you, Councilmember Rice. Appreciate it. We are going to dive in to our questions tonight. And our first question is, now that we've been speaking about racism so prominently, our first question is for Dr. Georges Benjamin. What is race and what is racism? Could you help us define that, sir?
Thank you very much for allowing me to be here with you tonight. So race is a social construct, which means it's artificial. It's based on phenotype, i.e. what you look like. And it really has no real genetic basis. Genetically, we're all about 99-point-something% the same. Yes, there are genes that code for skin color. Yes, there are genes that control for a whole range of other things. But fundamentally, we're all human and we're all the same. But society over time has constructed this construct called race. And racism is the belief in that either both a view and practice that one race is superior to another. Obviously, if one race is superior to the other, then you have to create mechanisms to maintain that superiority or to define that superiority. Now, you know, when we think about racism, think about it in two ways. Number one, institutional racism. So that's when you have differential access to goods, services, and opportunities based on that construct called race. And, you know, we codify that. So when people talk about it being institutionalized, that means it's been codified in law, in regulations, in practices. Things like redlining, not selling your house to people of color, those kinds of things are structural. And by the way, many of those things, even though practices may have changed, a lot of those laws still and practices and regs are still on the books in many communities. And then you have the idea, of course, of personally mediated racism, which is the common understanding of prejudice and discrimination, where a person, based on their views and beliefs, have a differential assumption on people's abilities, motives, and intent, again, driven by race. So there is something called institutional racism. There is something called personally mediated racism, and they're fundamentally different. So let me just give you one example how you might want to think about that. So Officer Siobhan, and I don't know what was in that man's head. I don't know what was in his heart, okay? I won't pretend that I know. But based on my observation, I would argue that assuming racism was the cause of what he did, his having his knee on that man's neck was personally mediated racism. The fact that it took several days for him to be arrested is institutional racism. And so the way to think about that is one is the behavior of individuals and the other is the behavior of systems. Thank you.
Thank you, Dr. Benjamin. That was a thorough definition for us, and actually got into some questions that I was going to ask a little later, but you already got to them. I appreciate that. Dr. Gayles, could you talk to us a little bit about how racism and racial inequities manifest themselves both in the healthcare system and other systems in the county and in the country?
Sure. Good afternoon and good evening, everyone. That's an excellent question. So I think the first component of that has to be answered in terms of looking at the totality of how racism can impact the healthcare experience. So racism, as has been brought up by the panelists so far, can impact in terms of how people deal with the stress. And so dealing with the stress and trauma of being exposed to racism in different forms, whether it's blatant outward racism that's perpetuated, or in places like Montgomery County, where we pride ourselves on not seeing those examples, in terms of implicit bias. And the realness and reality of how bias impacts all of our interactions from the boardroom to the parks across the board. Racism has a significant impact in terms of how policies are determined, whether we're talking about access to food, access to housing, access to transportation, access to health insurance, your ability to seek a medical appointment or have a provider to get the types of services that you need. As well as racism has an impact when you go into the clinical encounter. We have seen that there have been studies that have shown that when that Black patients are more likely to be given or assumed to have worse outcomes, worse adherence to medication, less likely to be prescribed pain medication, so on and so forth. So racism has the opportunity to impact health outcomes across a host of different spectrums and topics. Now, on the flip side of it, we also have to look at how race is, how do we capture that in data? As you know, one of the big issues in coronavirus, COVID-19, was how data was being captured, how it was being released. And then once it was released, it showcased and highlighted the significant disparities and the number of cases as well as the fatalities associated with it. And so what we have done in the county is worked very hard to put out data and information that tells a different story. It highlights the overall averages that the county enjoys. We are one of the healthiest counties overall across the country, but the data also highlights those pockets where we do see significant disparities. In Montgomery County, we know that if you're a Black resident, you're more likely to have an adverse pregnancy. You're more likely to utilize or have to utilize the emergency room for primary care related services due to access to primary care otherwise. We know that more likely, as has pointed out, to die at younger ages for preventable chronic disease conditions. And so it is something that impacts us significantly, and we're working from the public health experience to be able to put that data out so that policymakers and community advocates can utilize that information to drive the change and encourage the change from a systemic and systematic level. So hopefully that policies will be in place to address the concerns and improve the outcomes.
Thank you. Thank you very much. My next question is for Dr. Raymond Crowel. Dr. Crowel, if you could speak to how racism and racial inequity influence trauma and mental health of both African-American men and African-American people in general.
Okay, good evening. Thank you. And thank you all for doing this evening. You know, I want to back up a little bit, say fundamentally racism is an issue of stress in the lives of Black people. And that is the state of emotional strain or tension that results from demanding and adverse circumstances. So it is thinking about that. Stress can be a good thing, but it can often be a bad thing as well. So I think and when we talk about racism, it can be decidedly bad over time. So it affects us in a lot of different ways. How we cope with stress becomes important. And sometimes we can cope with things that are in not good ways. So there are behavioral things that we do when we're stressed. Smoking, drinking, drugs, nutrition, sleep, all those things can be shifted because of the stress we feel and just generally stress that we encounter if we don't manage it well. Weight gain, obesity, blood pressure, diabetes, heart disease, all correlated with stress. When it is chronic and you add racism as a chronic stress factor, now we're talking about the experience of trauma. And the trauma that we experience can be direct trauma, that our own personal events and experiences and encountering law enforcement or witnessing people in the streets being shot or dealing with that as a family member or assaulted. But the thing that I wanted to focus on a little bit was about the experience of indirect trauma, the secondary trauma that years ago you was just hearing about it from someone on the streets or in your neighbor. Now it is about witnessing it in social media in very near real time. So it's George Floyd, it's Diallo, it's Trayvon Martin, it's Tamir Rice. It gives us access to it in a raw and unfiltered way that we have not yet really, I think, accounted for in any of the research that we do. But that racism and that exposure to it sends us down some very, very dark paths. Physically, it can affect us. You know, we oftentimes don't like talking about how we feel about things in our community. And although I see that changing, but there's that real impact of if it doesn't show up in how you speak about it and express it in feelings, it can show up physically. in terms of ailments and aches and pains and problems with your body. It shows up as anxiety, sometimes clearly defined and attributable to something, but oftentimes it's sort of low-grade kind of, what's going to happen when I walk into this room? Or am I going to be treated inappropriately as I try to show somebody my passport to get on this plane? Or am I going to be stopped and given an extra pat down at the airport? So what's going to happen next that runs with us, that rides with us all the time? There's a level of depression that is possible from this, from prolonged exposure to this and prolonged sense of being told how to feel about yourself. That is, I've said this before and I'll say it again, racism is like salt water in the ocean, like the salt in the water in the ocean. It flows in us and we are part of it, and it is inescapable in America. It is fundamental to the structure and the building of America. So it impacts us both in terms of how people feel entitled to treat Black people in this country and how we respond to that. Depression can be a natural consequence of that. Suicide can be a consequence of that if we've had too much. And we are indeed seeing our young Black men taking their lives at increasing rates in the county and across the country. It's a challenge for us. Relationship problems and closeness. Our ability to care and express and form relationships with people is decidedly impacted by chronic racism. Guilt and shame, and I'll wrap this up in a second. Guilt and shame as a function of being Black and feeling Black and willing to identify with things that are Black and our Blackness. However we define that, there's sometimes some distancing we get from that, and an identification with the aggressor that goes with that sometimes. Anger, and I will say rage are a piece of that. That left unchecked just ties us up in knots as it pushes our adrenaline and cortisol pumps into overdrive for extended periods of time. And then, of course, there is a sense of powerlessness that no matter what I do, I'm not going to get even, I'm not going to break, I can't win, I can't break even, and I can't get out of the game. And that kind of sense of powerlessness feeds on oneself and one's sense of self-esteem and their ability to make a difference. And it is potentially a dream deferred that can have consequences, not just to the individual, but to society as a whole, at large.
Thank you for that. Thank you for that. That is, yeah, that's all encompassing, Dr. Crowel. Since we have started, Delegate Gabriel Acevedo has joined us, and I will ask him to just make a brief statement to the panel and to our audience.
Well, thank you very much, Tiffany, and thank you to all of the panelist participants. I appreciate all the organizers and facilitators for not only setting up this discussion, but bringing together policymakers, people who work in various fields that are experts in certain areas and can certainly speak to not just structural racism, but how that plays out in various parts of our society. I am certainly looking forward to this conversation. I think ideally what we should be working towards in terms of policymakers and society at large is building a just and equitable Montgomery County in Maryland, where Black pain isn't the prerequisite for progress. And I feel like we have these conversations all too often about what it is that government or nonprofit or healthcare professionals or folks in the C-suites and folks in academia must do in order to ensure that we're dismantling the structural inequities and we're combating racism. And so I'm hoping that we could get to a point where we are legislating, where we are crafting policies, and where we're doing things proactively and not waiting for situations like the death of a George Floyd or Breonna Taylor, or the kind of environmental injustices that we see in Flint, or the kind of educational inequities that we see in a number of public school systems throughout this country. I'm hoping we could get to a point where we're proactively working on behalf of oppressed people and not always requiring or not always expecting Black pain to come before that progress. So thank you all very much, and I look forward to being a part of the conversation.
Thank you. My next question is for Captain Sonia Prutt. And this really is a question about whether or not or how law enforcement is trained to eradicate their own personal racial bias and racism. Could you speak to that for us?
Mm-hmm. Okay, thank you for having me. So the police departments across the country all have a variety of ways in which we speak about training concerning biases and cultural awareness. We have implicit bias training, we have diversity training, we have cultural awareness training. Anecdotally, speaking as the head of the National Black Police Association, we kind of come to the conclusion that training is only as good as the person who is being trained and they're wanting to receive the information. If you are already inclined to have biases, and let's face it, policing culture attracts a certain personality type, type A, and we like control and power to some extent. If you are inclined to be that person and you combine your biases with the power dynamic that's in policing, that could be a recipe for disaster. It's necessary to have training and policy because that is the way by which you hold officers accountable. But if I could, since we're talking about this, and it's a great opportunity, I've learned something from people on the panel, Dr. Benjamin, Dr. Crowel in particular, and we're talking about systemic issues concerning racism, and the policing structure is, to me, one of those systems. I took a couple of notes I just want to share with you. So when you talk about traumas, there's trauma on the inside of policing structures that we project onto our communities, especially our vulnerable communities. We have things such as nepotism. We have cronyism. When you have pushback, when you dare speak about those things. And if you are an officer of color, or if you are a woman, and you talk about those things, or if you identify in particular to your Blackness, then you may be labeled a racist. So now you are carrying with you the burdens of a community who kind of giving you the side eye because you've decided to be the police. And you're also carrying the burden of coworkers who are looking at you as though you are the enemy because perhaps you don't think exactly like them because you come from one of those vulnerable communities. So here we are with these microaggressions and these traumas, and now we have to go out and we have to serve the public. It's a difficult thing to do. And I think that us doing that creates societal traumas in our communities as well, which is what's bringing us right back to the conversation about George Floyd and how that could ever happen. We have been tackling this issue, it seems like, forever. And now we're at a place where we can no longer ignore it. We can't backpedal. We can't moonwalk. We can't turn around. We can't act like it's not existing. And so the question then becomes, how do we deal with race in our law enforcement structures?
Thank you. Thank you. That was, I appreciate you speaking frankly about that, Captain Pruitt. I want to circle back. I'm a little bit off script, but I want to circle back with Dr. Crowel, kind of on the heels of what Captain Pruitt talked about and talking about the traumas that we endure, both inside and outside of certain structures. And I want to talk a little bit about coping mechanisms and how we have figured out how to cope with those traumas and with those stresses that are still, quite frankly, shortening our lives. But could you speak a little bit, Dr. Crowel, to the coping mechanisms that some of us could use to endure or push back against the racism that we face every day?
So that is, I was listening to Officer Pruitt and thinking just how right she was about this. There's a colleague of mine does some research on African American women in midlife, and one of the things that they found in their research was that in every group across the country, education affords is a protective factor for health, except African American women. That no matter how much education they have, it does not lengthen their life, decrease their maternal mortality rates. I mean, it is stunning. And some of that has to do with self-care, and some of that has to do with the systemic issues that we deal with constantly in the society. I think there's one of the things as a psychologist, and I'm probably one of fewer than 5,000 Black psychologists in this country, and as a Black male psychologist, even in rarer company, it's a source of pride for me, but also a sense of accomplishment and obligation. But one of the things about that is that no matter where I've gone over the years, there's always a moment where I'm sitting in a room and my competency, my statements about what I know about mental health are always challenged. There's always a question about that. Whether it's a management issue, whether it is what I know about treatment issues, what I know about how to manage a system, all of that stuff is often just a subtle question. And sometimes it is so subtle as I'm just going to have someone check in with you on this process for a while and monitor your work on this just to see how you're doing. And that was true when I was at Johns Hopkins. It has been true here in the county over the years. So it's one of those constant things. So I would say to you that I don't know that we have all figured it out, but I will say that there are some supportive factors around this for me and for other folks. Family is one of them, and a sense of belonging to family. And I use extended family in that regard to being who are those people that you trust in your inner circle that you can talk to and who will call you on your stuff when it's not right. A sense of racial identity and owning a sense of racial identity and not being worried about what other folks think about it is important, and holding on to that. Developing a sense of agency, especially in our children, is important, and a sense that they make a difference and that they can make decisions, and holding on to their rights and ability to do that. The presence of mentoring and caring adults are significant in every child's life, but every adult's life. There needs to be some place where there's someone who has been down the road a little farther than you are, who you can reach out to and who can talk to you about what is happening in your life. I think there's a sense of purpose in life, a sense of meaning in life. I'm a psychologist. This is the kind of work I would do if money wasn't an issue. I chose this career as much as it chose me as much as I chose it. So there's a sense of meaning about what I do that is independent of the job I'm in. A sense of meaning of life and community connection to church, to religion, whatever that is, it gives you a sense of purpose in life. And lastly, a sense of reality testing that is independent of what this world and this country tells you about yourself and about the reality of who you are as a Black person. If there was any one thing, it is question somebody else's reality. I have a colleague a friend who lives in, I think he's in Istanbul now. I don't know where he is, but last time I checked, he was in Istanbul. He's a Black man. And he said, it's one of the interesting things about white America that every white American, left or right, maybe not everybody, but will say that you ask, does racism exist? And they will say, yes, absolutely, racism exists. You say, well, is that racist? No, that's not racism. That's something else. Is this racism? No, that's not really racism. You've misunderstood or you've misread. That is incredibly subtle and incredibly undermining to a sense of reality. So get your reality testing tight and check it with some folks that will hear you and understand you when you call something racist and when you see it.
Thank you again. I appreciate that. Our next question is really for our legislators, and I'll make it a grab bag, so whoever feels moved to answer this one, please do. What legislation, and I know everyone will talk about what legislation has been passed in Montgomery County to help counter racism?
So if I could jump in, and I'll certainly turn to our county executive because he played a key role in this as well, but our racial equity and social justice lens that we have, as well as the creation of your position, Ms. Ward, were products of before any of this started. I will just say that I want to go back a little bit, because it was back in 2017 in July, almost 3 years ago, that this county said Confederate statues were not appropriate here in Montgomery County. And we actually had a Montgomery County Confederate statue moved to private land. While people are toppling those statues now, we did that back then. When we last year had our study by our public health officer, Dr. Travis Gayles, who said about racial determinants of health, and had that was well before all of these discussions. We have continuously been on the forefront of trying to get things to happen. Now, is it enough? Heck no. There's no question that to unwind all of that systemic racism and all those things that exist is going to take a long time. 400 years is not evaporated in 3, right? So let's just be real. And even in the 10 years that I've been on the council, it's not being unwound in that period of time. The reality is you keep chipping away at it, and now we've realized that we can no longer just use a chipping tool. We actually have to grab a jackhammer, because we can't wait any longer. We've got to get more aggressive about the things that we do and use opportunities like this, right? Use opportunities like this to push the envelope, knowing that the people who stand in the way of that systemic change are going to be less likely to fight as hard now, right? Because that's the thing that I want folks to understand, is that it's not easy to just pass legislation and get these things done, because I promise you that folks are watching this broadcast right now and saying, see, here we go. This is the uprising we've been talking about. We're going to have to fight it and make sure that we keep it tempered and we don't lose too much, right? That's what people are saying right now about this conversation. And so we have to be real about that. So I also just want to touch on something that we're working on. We had our resolution declaring racism a public health crisis. And so we just introduced that. But we also have legislation from the community policing bill to the LET Act, all kinds of things that we've been talking about pre-George Floyd, right? So we did that pre-George Floyd. And now even post-George Floyd, we have something that's about to be introduced that myself and Councilmember Jawando, who unfortunately couldn't be with us this evening, but he and I are talking a lot about some of the things that we need to do. Councilmember Navarro and Councilmember Albornoz are lead sponsors in this great piece of legislation that talks about use of force. And we're being very aggressive in terms of saying what use of force we think should be there. And we're working with our Chief of Police, Marcus Jones, as well. But this is important, right? So we've got to start pushing the envelope on these things. So there are a myriad of things, Ms. Ward, that are out here that we're working on, but there are things that we've been working on for a very long time. We are now going to have, as of August, a social justice lens on every single piece of legislation that passes in Montgomery County. That is a big deal, right? Because that's something, again, that we did pre-George Floyd, pre this movement, right? And these are the kinds of things that are incredibly important if we're going to be truthful about saying that we want to unwind the systemic racism that we see. So we've got to hold ourselves accountable, work with our state partners. So I'm really appreciative of Delegate Acevedo, who's on the call as well. He's been pushing at the state level and really trying to make things happen. I know that we have local partners like Lorianne Sales from our Gaithersburg City Council on the call as well, who keep pushing. The reality is that we're 1 or 2, right? 1 or 2 offs. I used to be the only African-American member on the council when Valerie Irvin rotated off, right? Now we have 2 again, which is the highest number we've ever had on the Montgomery County Council. 2 African-Americans is the most we've ever had out of our 9-member council. That says something. I mean, so when you're talking about initiatives, when you're talking about making things happen, that's a part. Sorry, I rambled on. I apologize.
You're fine. I'm going to give Delegate Acevedo a chance to speak about what's going on in the state, and then I'm going to start to take questions from the audience.
Yeah, I think it's important for us to look at dismantling structural racism at all levels, and also in spaces that aren't spaces of governmental power. So for instance, in C-suites, right? We talk about inequity. Oftentimes, the people we leave out of this conversation is the private sector. We talk about inequity in the labor movement, within healthcare. And I think that we have to be committed as policymakers to the solutions that are rooted in the communities most impacted. Those closest to the pain are closest to the solution, but seldom are they closest to power. And so it is the responsibility of people in power to then listen to those who are disproportionately impacted by issues for those solutions, and making sure that they're part of this co-governing model. Council member Craig Rice rightly pointed out that the county had taken a number of steps around social justice and racial equity, and we're attempting to do the same at the federal level. There have been efforts in previous years. Folks have introduced a bill that in essence would look at legislation that we introduce in the General Assembly through a racial equity lens. Every single piece of legislation. So as of right now, every piece of legislation introduced is assigned what is called a fiscal note, meaning what is the economic implications of this bill if it were to pass, good or bad, right? And so what we want to ensure is that when we're legislating or crafting public policy, we're also doing the same around race and equity, because we understand that this country is inherently racist, and a lot of the systems and the policies that we see in place has its foundings centuries ago, and we have to do the work of dismantling each of those policies and those systems if we have a hope to bring about true equity and justice. And that takes some time, right? But there has to be a commitment, and there has to be an intentionality in the way that we do things. A lot of folks don't realize that Maryland is the state that in essence gave America the blueprint on how to oppress Black people. We were the first state, the Maryland Colony Council, to pass what was called the Doctrine of Exclusion of 1638, that in essence said, no person of African descent will benefit from the fruits of white society. That later became, when other states adopted it, the slave codes. And then we started institutionalizing racism, both socially, politically, economically. And so it is incumbent upon not just Montgomery County, but Maryland to then be leading the conversation about what does reparative justice look like in every single aspect of our society. From healthcare, we see the how COVID-19 ravaged the Black community. And there's a lot of things that we can point to, whether it's a lack of health insurance or the profit motive within the insurance industry, whether it's housing, whether it's economics, right? Because we all know that poverty determines your healthcare. And so we have to be committed to tackling all these issues at every single area of government, but we should be pushing folks in the C-suites and in private sectors as well, because this is not the sole responsibility and function of the government, but everyone in our society, because inequity is deeply ingrained, not just in government, but in healthcare, in associations, in organizations, in institutions, educational institutions. And we have to be committed to doing that work that eliminates those years of injustice, those years of exploitation and lost wages and wealth, those years of declining health and home ownership. We have to look at it holistically. And government is certainly one part of that, but we certainly need more partners in that effort.
Thank you, sir. I know that County Executive Marc Elrich wants to speak to this as well. Mark, unmute yourself. You're muted.
I'm unmuting. It takes a minute from when you say unmute yourself to actually unmute yourself.
Okay.
You know, Craig, you made me smile when you were talking about dressing up, because I obviously don't have to do that. And I have, I think, never done it in my life. And I have, in job after job, at times told people, you want to fire me, fire me. I'm not putting that on. And I managed to survive. And I know that other people wouldn't get away with that. So that says a lot. So what did we do? So after we got elected, we worked with the council to get the racial equity stuff done. which I think is really important. After Marcus became chief, we directed and talked with him about what kind of changes we need to see in the department. Before George Floyd happened, and actually before the COVID virus happened, we had money in the budget to bring in an outside consultant firm to look at every aspect of the police department, from hiring to firing to promotion to training, all the things which I think need to be looked at. I mean, I've been one of those folks who's been saying, this is not a bad apple problem. There are bad apples, but on top of the bad apples, beside the bad apples, is a system which has encouraged a lot of some of the worst behavior we see. Protectual stops, you know that when the officer pulls you over and says, you don't have a dead body in your car. And you say no, and then the officer says, then you wouldn't mind if I search your trunk. And sticks on that theme for 15 minutes, being prompted by a supervisor in another car. That's a problem. And that doesn't come from rogue officers. Those are things that we're taught and encouraged. And there's other things that we're taught and encouraged. So we need to look at everything we do. And I think, you know, we've got the money in the budget to do this. It survived, and this is where we're going to go with this. When I was on the Tacoma Park Council and then spent time on the county council, and the two most important things I think I did in my life, one was getting rent control in Tacoma Park, actual, real rent control. Because who did rent control affect in Tacoma Park? Didn't affect wealthy residents in Tacoma Park. Didn't affect all the homeowners. It affected the 4,000 housing units that were primarily occupied by lower income people. We were a walking distance from the metro. And once Tacoma Park started to so-called clean up and no longer be the alternative culture haven that it was in the 60s, there was a lot of pressure on rents. And when we put rent stabilization, it was a decision to say these people have a right to live in Montgomery County, and we're not going to let the market push them out. And at the time, the likely place where people would have gone would have been Prince George's County. We knew that a lot of struggling in terms of income families had moved to Tacoma Park because of rent stabilization and the fact they could put their kids in Montgomery County schools here. And I felt, you know, that law is still in place. And I feel like that did more to provide opportunity for people and protect people's ability to live in the county than anything else. And I feel similarly about the minimum wage law. Minimum wage, unfortunately, is something that affects people for long periods in their life, particularly in the minority community. It's no longer a starting wage, but for a lot of people, it's the sentence you get for being the labor that we can exploit. And so those are two things I thought were really, really important in terms of being able to lift people up and begin to change people's prospects. The wage was the beginning, it's not the end, and that's where we need to follow on with education and training so that once you've got a job that lets you be stabilized, you can actually get the skills you need so you can move up the economic ladder. I feel the same way about home ownership. You can't build wealth without home ownership. So one of the things I've been talking with our nonprofit community about is I need them to shift their housing focus from rental housing to ownership housing. They've got to embrace the idea that low-income people can actually manage their own affairs and own stuff. And to the extent they need help with credit counseling and the other things, what I've asked people to do basically is consider owning things for 3 to 5 years and working with your tenant community to transition them into an ownership position where they can ultimately become the owners of the units. If we don't address something as fundamental as home ownership, and all this talk about the disparity between black wealth and white wealth is not going to budge one iota. It will not. Rents are almost as high as mortgage. In fact, in some communities, even my community, rents pretty much approximate mortgage payments. The difference is they can't raise up, they don't have the savings to put down the down payments that are required to transform them from renters to owners. So I think, you know, that's the kind of work I'd like to see us do. I want to see the report come back on the police department because that is critically important. And I know, you know, there's been a lot of talk about defunding police, and I don't know whether it's all defunding because at the end of the day, you got to examine what you defund and what that means for services that people actually want the police to do, because there are things that people actually want the police to do. But the police do too much stuff that is basically should have been in the social service sphere. And because we've walked away from poor people, low-income people, and said, you're on your own, then if you're homeless, it becomes a police problem. You know, if you're unstable, if you're depressed, if you're being affected, poverty is affecting your mental health or sense of well-being, that's a police issue. A whole host of things that should be social issues or police issues. And I feel the same way about the school system. We put the entire burden on them to change the outcome for these kids academically. I was a school teacher for 17 years. You walk into my classroom hungry. Your parents are fighting over money because they don't have enough of it. They're afraid about being evicted and having to move to another apartment in another year. And a kid is subjected to all that. And then you say, I'd like you to come in here and switch all that off and please pay attention to my lesson and get serious. So we've asked the schools, sort of like police, to manage 8 hours of a kid's life in total denial of what else is going on. And it's not for the schools to assume that it's for that role. It's for us to assume that role. And those are the changes that I want to see made. And I look forward to working with people and to get beyond the feel-good legislation that is, it gives people a bunch of paper rights and focus on things that give people a bunch of economic reality doses. That's what I'd like to see changed.
Okay, I'm going to take one question from our audience. And really, County Executive, you've already addressed it, but I will give other folks a chance to address it. And so folks have asked about what it means to defund the police. And I will add on to that. If defunding police, but I also want people to imagine what public safety could look like. What public safety could look like in a way that Black people feel safe, feel not traumatized in their spaces and other spaces, can feel a sense of belonging and agency. So I will add on to what does it mean to defund the police. I'd also like you to talk about what does it mean to reimagine public safety for Black people who are often most harmed by the police. So yes, you guys, who wants to jump in on that?
Sonia, this is Delegate Asper. I'm happy to respond to that. I think it is the responsibility of policymakers, people in power, to listen to the organizers and the activists on the ground, and to not get caught up in hashtags, but to understand what communities mean and to intentionally listen. And I think if folks did, they would realize that the United States as a country spends more money on law enforcement than any other country spends on military, right? As a country, we spend more than any other country on law enforcement, bigger than that of military budgets of other countries. If we look with respect to Montgomery County, the council recently passed a $288 million budget for the Montgomery County Police Department. And when we think of all the inequities and when we think of all the priorities as it relates to our budgets, because budgets really are a moral document, they in essence say what we consider to be priorities in our society and what we consider to be less of a priority. And so when we look at budgets and we see that we're spending these exorbitant amounts of money on law enforcement, and yet we don't have enough money to deal with the issue of homelessness or the issue of economic insecurity of helping small minority and disabled-owned businesses, that is what it means to defund the police. It is a recognition that we are allocating way too much of our budgets towards law enforcement and public safety. And what communities and oppressed communities are getting out from that is more brutalization, more over-police communities, because the Black community is the most over-police community in America. And so when we talk about things like the militarization of our police departments, a majority of those military weapons and a majority of those police officers are in our communities, right? And yet we're looking at all these military equipment on our streets, and then our kids leave our homes every single day to schools with crumbling infrastructure, or no proper air conditioning or heating, or teachers who do not have the resources that they need in order to teach, or students who cannot get a free meal every single day. That is what we're talking about here. We're talking about budgets, we're talking the morality of budgets, and we're talking about what we consider as a priority in our county and in our state versus what we consider as less of a priority. And so folks shouldn't get caught up with the hashtags, but instead listen to the organizers and the activists who've been saying this for a long time. This is not something new. A number of individuals and organizations have called for the defunding of the police, from the 1970s, 80s, and 90s, because as the budgets grew with the crime bill and all these other things, we saw more and more resources going to law enforcement and less to marginalized and oppressed and vulnerable communities that need it the most. I want to come back really quickly and touch on the state legislation that I'm working on that I think relates to the conversation around equity and justice around healthcare. I've introduced the Healthy Maryland Act, which in essence would bring about a single-payer Medicare for all system in the state of Maryland. A lot of people don't realize that Maryland is the only state that if it wanted to pass Medicare for all, it can do that. And so we often look at our neighbors, Canada to the north, and we see how they have a universal healthcare system, but it started by one of their provinces or states, as we say in America, passing Medicare for all, and then the federal government deciding to expand on it. So Maryland is to the United States what Saskatchewan was to Canada, and we have an opportunity to lead. If we want to eliminate the health disparities amongst Black communities and Black men, it starts by ensuring that all of us have health insurance, that all of us receive the kind of a culturally responsive care that everyone should get, right? And so we need to look at legislation like that at the state level and demand that Maryland lead on it, because we are one of the wealthiest states in the union. The second thing is around education, because we can't talk about social determinants of Black people without talking first about education and the kind of schools that we go to, the kind of educators that are put in classrooms in front of Black children, the kind of curriculum that our kids are taught from. All of that plays a role in this conversation. And so at the state level, we've been pushing, as folks know, the blueprint for Maryland's future that in essence would reform our education system here in Maryland, our public education system, to ensure that we're not just funding, we're not just supporting teachers, we're not just creating culturally responsive curriculums that deals with the kind of sanitization of history that we see today in public school curriculums, but it also deals with the issue of school construction. And that is a big part of that. Although the governor vetoed it, we need to be pushing, because when we talk about equity, it starts with education, right? It starts with healthcare. It starts with housing. And so we have to push for that type of legislation at the state level. And lastly, when we're talking about things like police violence, I completely agree with Sonia in that police departments have a culture that we need to deal with. And this culture, in essence, attracts a certain kind of a people. And one of the things that I haven't heard from this discussion as yet on police brutality is the role of white supremacy and white nationalism within police departments, right? Folks in Virginia, I forgot, I think it was Arlington, laid off about, what was it, 4 or 5 cops. In the city of Philadelphia, they let go around 70-something cops after finding out they had belonged to white nationalist groups outside of work. And so we need to look at policing and racialized policing more holistically, and not just think that we can train our way out of systemic oppression, right? Those closest to the pain are closest to the solutions. And Black, Indigenous, and Latinx communities have presented solutions to police violence before. This is not new. And so we have to be intentional about the people that we're listening to, but state legislatures are in the driver's seat of this issue around police violence, and that's where our efforts should be focused. Surely the county executive can do something too.
Thank you, Delegate. I have 2 more, I'm sorry, I have 2 more folks I want to get to and 1 more question, and we are 10 minutes to the end. I appreciate your enthusiasm and actually all of what you've said. Councilmember Rice, and then I want to go to Captain Pruitt.
I'm going to be very, very fast. So Delegate Acevedo is right. A moral document is our budget. Police represents 5% of Montgomery County's budget. So let me just be very clear. We've got a $5.6 billion budget. 50% of that, a little over 50% of that actually goes to education. So we prioritize education here in Montgomery County. Health and Human Services is larger than that budget. So certainly we're focused there. Now, I agree with what the county executive says, and he laid it out very correctly. Look, what we need to do is we need to stop having our police handle mental health in our community. We need to stop having police handle, talking to a student in a classroom and saying, look, we want to give you the support that's necessary for you to feel more comfortable, like our school resource officers that are specially trained that folks know I actually think do a great job, but we've asked them and we train them in a very different way. They're very different from our other police officers. And the reality is, could we do that under the auspices of Health and Human Services? Of course we could. Having a positive role model and a voice in the school system to be able to talk to our kids about making positive choices and doing the right things, it doesn't have to happen within our police. It can happen in other ways. So repurposing, right? I don't know if we need to say defunding, but repurposing some of these positions and this priority to shift more to problems that we know happen in our community. And I have to say their names, look, because I know, again, it was a tragic situation, but it was a failure on our part, right? And wrongdoing is something that the courts will decide, but it was a failure on our part when both Fina and Berhe and Robert White died. Because from a mental health aspect, folks who are experiencing a mental health should not have to face the ultimate judgment of death because they were having a mental health condition or breakdown. That is not acceptable, and that's not okay. And we believe that, right? We as elected officials believe that, and I will say that. So for us, it really is about being realistic about what's happening. But I will tell you this, and Delegate Acevedo knows this all too well. In our community of Montgomery Village, every time I go to Southlake Elementary School, I hear from the parents there saying, you know what? I need you to protect my children. I need to make sure that you have police officers, because if my child walks down the street, right, they're getting recruited by gangs. They're getting recruited by, so what do? We say, okay, well, yeah, we understand that we want to focus on police, but we also have our street outreach network. And we put huge amounts of money in investing that. And Luis Cardona will tell you that we've invested so much money when it comes to making sure that he's expanded his program over the years. So when it comes to saying that our budget is a moral document, I will just say that that's true. And our morality is in the right place. Do we have more that needs to be done? Absolutely. Are we headed in the right direction? I think so. And do we need to make some substantive changes? We definitely do. But we can do that with the guidance and leadership and all the folks being partners, community, and all the people who are on this call to help guide us in that direction. Thank you.
Okay, so we're talking about defunding, and I guess we're not talking about disbanding. That's a good thing. That seems to be the other catchphrase that's causing people to be very nervous. So a little bit earlier, I talked about training and policy. So on a personal note, I've always felt that one of the obstacles to equity in policing is that there's an education piece missing. The police department in Montgomery County did try to tackle this education piece, and that education piece is the history of the intersection of policing with our most vulnerable communities, in this particular case, the Black community. We're taking our recruit class down to the National Museum of African American History and Culture. We've taken our executives there, but that's just a small piece. You don't have a lot of time to really absorb it. I think that over-policing and militarization, people don't understand what that means inside police departments. They feel like, oh, it's okay for us to drive this tank and have this this rocket launcher. And then there's this particular community has the most crime, so we got to go in there and we got to fix it. And really, that's not fixing it, it's making the problem worse. And so the education piece that I'm talking about started with slavery, and then emancipation, and then the 14th Amendment, and then Reconstruction and Jim Crow, and the Civil Rights Movement. okay? And then mass incarceration, which takes us all the way back to the 14th Amendment. I mean, there are pieces that are missing that police officers do not know. Now, there's gonna be a segment of police officers who are not interested in it. That is real. They don't wanna hear that. They're stuck on, this is what we're supposed to be doing. Policing culture is deeply entrenched. But for those officers who really want to know why we are where we are right now, they could be taught. So if we're talking about, taking a look at how reimagining training, that for me is a personal piece that I think that we need to insert into our training and then into our policy. You know the history, so this is what we expect from you.
Thank you all so much. I really appreciate everybody's time, energy, and passion for this topic. We are getting to the end of our program. I want to acknowledge Delegate Charlotte Crutchfield, who's in our audience today. I promise we'll get you on a panel on our next town hall, Delegate. And we have actually a spoken word artist here who's going to share a piece with us. This artist is called Lancey Keir.
Hello, hi everyone. Hi, my name is Lancey Faith Keir. I am a graduate of Paint Branch High School, and I will be attending the University of Pittsburgh. And today I will be performing my poetry performance titled Struggle Free to Me. God facing and chasing, my body shaking, and my heart is racing. All because my face was mistaken. Don't shoot! I say, but I'm afraid he might. Another life taken that didn't even fight. I am more than my complexion. Love and determination are my only reflection. Who are you that dares to question? Living in color, but only seeing black and white? Too scared to drive every day and night? I become numb to the things that confine me. I become numb to the things I let bind me. The gravity of this tragedy I choose to overlook and go about my days so naturally. I come to school to get educated, but still, my mind is fixated. And I am frustrated with the fact that I don't feel safe. I said I don't feel safe. A student getting shot on the way to my school. People taking lives to gain a rep, thinking it's cool. We live in a society where kids are going out with a bang. I said we live in a society where kids are going out with a bang. And the world would be better off without me. Were the songs that they sing. The waves of mass destruction and corruption continues to be our conviction. Afraid of change, still stuck in the same, ashamed. We only have ourselves to blame. But you know what? Light. Shine on this darkness and rid us of these hardships. Seeing more than color and living in unity is what we long for. Compassion and togetherness is what our hearts should bear, not hatred and bitterness that leaves our mind, bodies, and spirit sore. To love, to hate to love is wrong. But to stand as one, because together we are strong, is to make this world a place where everyone belongs. Thank you.
That was beautiful. That was wonderful. Thank you so much for sharing yourself with us tonight. That was a wonderful way to end our discussion. Thank you so much. I want to thank all of our panelists. I want to thank all of our elected officials, our county officials, our audience for coming and listening to this discussion today. And I want to encourage everybody to continue this conversation about the impact of racism on the health, the mental health and public health of Black people, not only in this county, but in this country. You all have been wonderful. I look forward to having another panel with you all. I am hopeful that we continue to work together so that all of us have an incredible quality of life, right? So thank you so much. Appreciate it. Have a good night. Please take care of yourselves.